Hi guys, welcome back to the channel. So last class we have started with Gardner syndrome. We have seen that it is an autosomal dominant trait caused by mutation in APC gene which is present on 5q chromosome. We have seen the tetrad of Gardner syndrome. First is osteoma, second is intestinal polyps, third is epidermoid cyst, and fourth is soft tissue fibromas and fibromatosis. Along with that, we have also seen that supernumerary impacted teeth are also present. In osteomas, we have seen that it is large multilobulated at angle of mandible, teardrop shape. Then we have seen that it will exhibit 3 or more osteomas of jaws, and in skull mainly frontal bone is affected with osteomas. Then in intestinal polyps, we have seen that it develops later than osteomas until patient reaches early 20s, and malignant transformation is time dependent. 5% at puberty, 50% at age of 30, and 100% by 50. And then we have come to epidermoid cyst. We have seen that about 60% of patients develop epidermoid cyst. It is also developed before intestinal polyps, and it is most frequently seen on face, scalp, arms and legs. So we have seen that epidermoid cyst and osteomas develop before intestinal polyps. Now we are dealing with the fourth one. We'll be starting the fourth one in the tetrad of Gardner syndrome, that is soft tissue fibromas and fibromatosis. Let's start. It can be abdominal or extra-abdominal desmoids. So this soft tissue fibromas and fibromatosis are called desmoids. So it can be abdominal or extra-abdominal. Are infiltrating fibrous masses seen in 15 to 30% of Gardner syndrome cases. So they are infiltrating fibrous masses, and they are seen in 15 to 30% of Gardner syndrome cases. Some of these tumors arise de novo. De novo मतलब अपने आप. Some arise following surgery, during surgery or following surgery, and some arise after removal of the desmoid tumor. That is recurrence. In maxillofacial area, it had been known to infiltrate the masticatory muscle and suprahyoid muscle. So in maxillofacial area, it infiltrates the masticatory muscle and suprahyoid muscle. Now coming to differential diagnosis, based on multiple radiodense masses with impacted and supernumerary teeth, the differential diagnosis for Gardner syndrome can be cleidocranial dysplasia and florid and periapical cemento-osseous dysplasia. And this is based on multiple radiodense mass with impacted and supernumerary teeth. तो इन दोनों में भी जब हम लोग OPG panoramic radiograph देखेंगे तो इन both cleidocranial dysplasia, florid and periapical cemento-osseous dysplasia will appreciate this. Okay. Now based on produced intestinal polyposis, और अगर इंटेस्टिनल पॉलीपोसिस हम लोग डिफरेंशियल डायग्नोसिस में कैलकुलेट कर रहे हैं एज एन, और कौन से सिंड्रोम में हम लोग को इंटेस्टिनल पॉलीपोसिस मिलेगा अदर देन गार्डनर सिंड्रोम इज जुवेनाइल पॉलीपोसिस ऑफ कोलोन, टर्कॉट सिंड्रोम एंड काउडेन सिंड्रोम. तो इन तीनों में भी हम लोग को इंटेस्टिनल पॉलीपोसिस मिलेगा. बट हाउ कैन वी डिफरेंशिएट? वी कैन डिफरेंशिएट बिकॉज गार्डनर सिंड्रोम विल शो द टेट्राड. इट्स वेरी इंपॉर्टेंट. इट विल शो ऑल द टेट्राड basically. Now coming to diagnostic workup, panoramic and skull radiograph, obviously we have seen it is important because it for osteomas, and panoramic for all. At least one osteoma should undergo biopsy, obviously to rule out if it is associated, and a lower GIT barium study should be done. For mainly abdominal or extra-abdominal desmoid, this test should be done. एंड ऑस्टियोमा शुड गो वन एटलीस्ट मल्टीपल 3 और मोर ऑस्टियोमास होते हैं, एक ऑस्टियोमा का बायोप्सी इज वेरी इंपॉर्टेंट इन गार्डनर सिंड्रोम एंड द रेडियोग्राफ. That's all for today. We'll be completing Gardner syndrome in next class. Till then, like, share, subscribe and comment. Bye.